or most of you know, my name is Nancy Chege I work for HuQAS as a quality and technical officer. And today I want us to talk about financing of EQA. We've had so many good things this morning and yesterday. We've heard from the mentors, we've heard from the assessors, we've heard from the participants, you people who work in the laboratories that need to get accredited. So one of the very key things when it comes to accreditation in quality management systems that most of us know is EQA, or proficiency testing. Now that we know the value and why we need to do the EQA, there's a very big elephant in the room, in the room that we need to discuss. How do I get money for my EQA programs? Because we all agree that it is good, it is the best, and we all need to take part in. So I just want to give I don't have the solutions on where you can get the money. I just have suggestions and data from HuQAS of where most of our participants get their funding. So with this case study, maybe you may get ideas on how to approach your EQA programs, financing, and all that. So we all know the role of the lab. It has been overemphasized over the years in this conference and in many other forums. There's the common saying with this, a common phrase of 70% rule, or some 70% rule, where 70% of all medical decisions are made in the laboratory. So we are the superheroes we are the superheroes of the healthcare sector. So that tells you how important the lab is. And not just the lab, but it needs to be a lab that provides reliable and accurate results. Because if you're being dependent on to give 70% of medical decisions and you give bad results, that means we are also the biggest contributor of mistakes or healthcare errors that happen, to our patients. So when you talk about laboratory, we narrow down now to the proficiency testing. Why do we need this proficiency testing? And we are in the era of pandemics, left, right, and center. COVID, Ebola, monkeypox, and all that. So in this era, there's something we're calling integrated disease surveillance system that rely on diagnostics for countries to diagnose and report cases of any new diseases that come up or anything new that they find out. So we need to be very, very accurate in this diagnosis so that we can report the right results and share the right data internationally and regionally and nationally, and especially to our patients. So proficiency testing, or EQA, however you want to call it, it plays a very significant role in helping us come up with these, giving the right results, doing the tests right, and avoid all the problems that come from misdiagnosis that the other presenters talked about. And now, since I'm giving a HuQAS perspective, I might as well give you the history of HuQAS. Majority of you know HuQAS is synonymous to EQA. It is in the name, Human Quality Assessment Services, because that is our bread and butter. It is what we initially set out to do. So HuQAS started in 2000 as an after-sale service for one of the distributors of equipment. And with time, because of demand and the need in the market for a reliable EQA provider, it was incorporated in 2007 as an NGO. So it's to support laboratories to provide quality results. And later in 2007, we got accredited to ISO 17043. So this is the international standard that regulates proficiency testing providers. And like Doris said, we've been accredited since 2009 to date. You can count the number of years of accreditation. So the data that we give here is a good snapshot of overall performance of EQA in the region, because we do not only cover Kenya or Uganda or Tanzania. We go beyond. We go to West Africa, we go to Southern Africa countries. We are in over 20 countries now. So it's a good representative of performance in the region. So our laboratory systems, like we've had before, over the years, we've had a lot of focus and concentration in the lab, significant focus and funding and goodwill and a lot of support and a lot of mentorship, a lot of money in billions or millions of dollars. And this was specifically, it started significantly in 2008 when we had the Maputo Declaration on the support of strengthening laboratory systems. So this is where donors and stakeholders committed to support laboratories to grow. Previously lab used to be that room in the corner, in most places, neglected, and most people did not understand. So over the years, we've seen significant growth and significant funding. A lot of resources have been pumped into the laboratory. And that resulted into significant funding for proficiency testing, for laboratories to enroll in proficiency testing. So I want us to look at, from the year 2017 to 2021, the people who enrolled in the medical labs that enrolled in HuQAS EQA, how did they get their funding? How many were sponsored? How many were self-sponsored? And how many were sharing the cost of sponsorship? So with our data, with the review of that data, we found that the majority of the labs that we have in our program are public laboratories. That comes without, it's not a surprise because like we talked previously in the accreditation session, majority of the labs in most countries right now are accredited labs are public labs because of all that funding and support. It catapulted them into accreditation. And with accreditation, proficiency testing is not an option. You have to have it. So as the accreditation journey grows, the proficiency testing journey also grows. So we have 45% of our participants within that period were public laboratories, followed closely by private laboratories. So these are profit-making facilities owned by individuals or institutions. And then we had faith-based organizations, and finally the NGOs. So among these public laboratories, among all these 4 laboratories, the number of self-sponsored labs were the majority. So this tells you that majority of the people that enrolled in EQA, in our case, were self-sponsored. And followed closely by the sponsored and partially sponsored. So these partially sponsored are the guys that are getting a boost from one donor or another. So the donor pays probably for one program, and then they say, we'll pay for 2, sharing the cost. So among the partially sponsored, the FBOs, the faith-based organizations, were the majority. Because there seems to be a culture that we've seen with faith-based organizations of commitment to the provision of good results, of quality service, probably propelled by their principles of compassion and service to humankind, because most of them are not for profit, so they're not interested in any profit. So they end up channeling a lot of their resources into services, EQA services, or quality service, quality assurance measures. Public labs are also following closely, because like we said, we have had donors for many years, but over time, these donors are trying to bring up the issue of sustainability. Like Julie rightly said, sustainability is an issue. So one of the ways of winning these public laboratories to become self-sufficient is to make sure that they at least take the initiative to get 1 or 2 programs for themselves. And then the donor takes care of the other. It's a motivating factor. And then we did not have any partially sponsored private or NGO. So partial sponsorship was mainly in faith-based organizations and public organizations. And then if we look at the self-sponsored laboratories, these are the guys that are paying for EQA for themselves. They were majorly private laboratories, obviously, because if you're making business, probably very few people will give you the money to make your business better, to make more profit. A lot of this sponsorship goes to labs that are serving people for not for profit. So our private facility laboratories were the majority in terms of self-sponsorship, and followed closely by faith-based organization, probably because of what we said, the principle of compassion and taking care of other people, a quality service, and then the NGOs, and lastly, public laboratory. So this is an issue that we talked about in the morning. Public labs being mainly donor funded, and very few of them, but the number has been growing. If you look at the data over the years, a few public labs are winning themselves from the donors and taking up the responsibility for themselves. So kudos to these public labs that are taking the initiative, and the rest of us, probably we should join the journey. This is the proportion of sponsored labs that we have. It shows that majority of the share goes to our public facilities, and that goes without saying, because most of us get a lot of support from our donors, from our implementing partners, and other goodwill people of goodwill. And then some faith-based organizations have some little bit of funding, and then NGOs have some little bit of funding, and private hospitals have 0% funding. So that tells you, if you're a private lab here today and you're probably looking to enroll in HuQAS, your chances of doing that through sponsorship are very minimal. If you're a public facility and you want to enroll in HuQAS, your chances of getting sponsorship for that are very high. So that gives you an idea of how you can start thinking about how to finance yourself or to get a donor for yourself. I think in this room we have quite a number of implementing partners. Take advantage of that and see if you can talk nicely to one of them. So those were the findings. And something significant with sponsorship, it's very, very critical, it's giving us a very good advantage, because once you are sponsored to enroll in HuQAS, that means you end up having quality services. That is, if you utilize that HuQAS program very well, you are able to deliver quality services at very low cost, because the donor is absorbing this cost. You are not absorbing the cost. So it leaves you to free up those resources that you could have used for those HuQAS. You are able to have those resources and channel them to other projects, probably reagents or IQC or something else that is not funded. So at the end of the day, you end up getting double benefit, because you have quality services, and these quality services, you cannot reflect that cost or trickle down that cost to the user or the client. So the service ends up becoming very affordable, and that's how most public hospitals or public laboratories are able to remain very competitive compared to their private counterparts. Because with the private facilities, they end up facing a challenge, because we've seen majority of them are self-sponsored. That means they have to go out of their pocket and allocate a budget for proficiency testing. And when that happens, that budget they have allocated has to trickle down to the cost of their laboratory tests. So their laboratory service ends up being relatively, significantly higher, because that cost they used for the proficiency testing has to be covered by you as the user, unlike our counterparts who are sponsored, which is a good thing, because I mean, for the common mwananchi, for the common citizen, those of us who cannot afford to go to those privates, we are able to get very, very good services at very low cost in our government sponsored facilities. So the takeaway today, or the point for today, is that donor funding is contributing significantly to proficiency testing in the region. You've seen the data that that's data from more than 20 countries in Africa. With that, we have our affordable quality testing, but we can do better. We can do better as public facilities in terms of taking up some of that responsibility. How can we do this? We can link up with our private friends from the private facility. If you're sitting next to if you come from a public laboratory and you're sitting next to someone from a private laboratory, ask them how they do it. Understand their model of financing. Like, I think it's Julie who said in the morning that there's no laboratory that makes any losses. However cheap your services are, you should be able to make something, and that something should be be able to buy for you EQA or proficiency testing. So we should be able to learn from each other and have strong private-public partnerships, so that we can, at the end of the day, we can integrate all of our laboratories, both public and private, into an sustainable proficiency testing that stands the test or the trials of time. And with that, we will end up having our laboratory system growing or shooting and growing very much, such that we have very high quality of care for everybody. Everybody will be covered. Imagine if every laboratory, every lab here participates in proper proficiency testing program, and not just participating, but acting on the results or the findings that you get. So we end up improving all our system, and all the errors that we've been getting will be able to eliminate them. So we end up, we don't have misdiagnosis. So that is what I wanted us to know today, that you now understand the model of financing. You have a few ideas. You can now know where to start. If you are public, private, NGO, or faith-based, you have an idea of where to start in engaging in EQA. And it is a challenge to all of us to take up the responsibility, to own it, own the process, and walk the journey. Thank you very much.